All right, welcome back. We have two more sort of sessions here where we're learning about endometriosis for Endometriosis Awareness Month. Thank you, Andrea, for being our expert in this field. And what do we want to sort of talk about? I know, so Choice Physical Therapy, we're a physical therapy practice, and we really promote how we can help others with various diagnoses. So I wanted to just say, what sort of light or where have you sought physical therapy that's been helpful for this? And yeah, we'll sort of just go from there.
Sure. Something I sort of neglected to mention earlier in terms of some of the warning signs or symptoms that can be associated with endometriosis. Painful sex is also one of those symptoms, which often is associated with a hypertonic or an overactive, super tight pelvic floor. For myself, I've been going to pelvic floor physical therapy. And when I go regularly in the past, when I've gone regularly, it's really sort of cut down on my daily lower back pain. So whatever is done during those sessions is sort of loosening things, lengthening things that are constricted or in spasm, and just sort of opening things up and giving me relief, especially in my lower back. So during my pelvic floor physical therapy sessions, they do outer work on my back, and then they also do internal work in terms of, where my muscle spasms are. They have offered me various products, CBD products actually, that are suppositories that can sort of, give you that anti-inflammatory impact and sort of relax things, decreasing your pain. I think I mentioned earlier the use of cupping and just soft tissue mobilization, breaking up some scar tissue from previous surgeries, and the adhesions that can happen with endometriosis is something that I found very, very helpful in terms of reducing my daily pain.
That's great. And so one thing that we know as physical therapy is our physical therapist is that if there is restrictions, adhesions, scar tissue, a lot of hands-on therapy through soft tissue mobilization, cupping, the tool that we use, the Graston technique, for more of that abdominal restrictions or scar tissue mobilization, as well as low back adhesions around the fascia. That sort of, because a lot of times if there's so much going on in the front with your pelvic pain, pelvic floor, sometimes if that weakens your core or your abdomen because of sometimes where your pain is. And I know, what is it called? I think you referred to it before as like endobelly, where you get that inflammation in the front. And so
Mhm.
sometimes that can impact the stability of your abdomen or your core musculature with that weaker pelvic floor. So much of that makes your back muscles turn on extra or sort of be overworked, which turns into that hypertonicity. So there is a world for physical therapy. It certainly doesn't address all of the symptoms and what's going on the inside at the cellular level and the inflammatory level, but for some symptomatic relief, pelvic floor therapy where you're able to get the internal, especially with the different, and that's something that we don't really do at Choice PT, but there are other local physical therapists who do pelvic floor PT. But if you are trying to do more of that core strengthening or low back release for the soft tissue restrictions, that's something else that can help.
Yeah, and like we've mentioned before, it is a full body disease, full body disorder. So that requires a multidisciplinary approach. So incorporating the use of, a surgeon, a nutritionist, a physical therapist, all of those things can be incredibly beneficial. And yeah, just sort of attacking it at all sides can be helpful more than just going with one method of symptom management.
It certainly creates for a busy calendar, bringing in mental health as well. But when
Mhm.
it's about your body and your well being and your ability to thrive, it's really important. So, thank you for touching a bit on that piece.
Of course.
All
Thank
right,
you.
talk to you later.